This stitch is a buried interrupted stitch, and the way to remember this one is deep to superficial, superficial to deep. Often laparoscopic and robotic incisions are about 1 centimeter in length. And because they're surgical incisions, we use absorbable sutures like Vicryl or Monocryl. And because they're absorbable, we want them to be below the skin surface. So as the patient's wound heals together, the stitch absorbs and breaks down over time, and the patient never has to have a stitch removed. So the way to do this is you ideally want to close this with 1 stitch that you don't see. Okay, so we're going to start on, if you're right-handed, you're going to start on the left side of the wound. You're going to go in the deep layer and come out in the junction between the epidermis and the dermis. It's hard to see on this kit, but on real skin you can see the area just below the epidermis where you're going to come out. The easiest way right here is to just go ahead and pull your needle through and reload it at the same time. So you're going to want your needle back loaded, so backwards and upside down. Okay, so you can pull your tail through if you like now, or you can do it at the end. And then we're going to evert the skin edge on the opposite side, and we're going to go exactly across from where we came out with our superficial bite over here on the other side. So I'm going in, my hand is out of the needle driver holes, my fingers are out of the holes, and that gives me better mobility of my wrist to push this needle through. So I'm going into the skin edge, the epidermal dermal junction at about 90 degrees, turn my wrist, and then I'm going to come out in this deep layer here. Can you see that? Okay. And I'm going to move my loop out of the way so that my needle can come out on the same side of the loop as my tail here. Okay. So that should pull down nicely. Yep, see how you can't see it? And so here's what I have left, my tail and my suture here. So what I'm going to do is the same thing as before. So here's kind of like the V we were looking at before. Put your needle driver in between. There's your surgeon's knot. Okay, that should lay down square. You can see my square knot here, and pull it in the direction of the wound. So you pull down. Okay, same thing as before. You're going to make your 4 knots. 2, 3, and 4. Perfect. Okay, so see how that's laying down nicely, and now my tails are sticking out. So any surgical wound where you need to cut the tails, it's a little bit different than how we've shown you how to cut tails on the other sutures that are outside the skin surface. This, we don't want the tails sticking out. So the proper way to cut this, and when you're a student, you'll often be cutting for surgeons or other PAs or residents, is open your needle, open your scissor a little bit. You want to kind of slide down the suture line here, the tails. When you feel the knot at the bottom, you turn your scissors 45 degrees and then cut. And that way, you'll never cut the stitch. And see how, if you open it up, you can see my stitch buried there, but it kind of closes back together and you don't see anything on the outside. And that's ideally what you want, 1 stitch pulling that back together.